Hey everybody, my name is John Stewart. You're on Facebook right now. I don't need to tell you that. Facebook Live. This is our program. It's called 9/11 Were You There? And you can use the hashtag Were You There. You can go to 911wereyouThere.com. We are at the 9/11 Memorial and Museum. You can see the last column standing right behind us. That was the last column standing from the attack. It's been decorated with messages from friends and family, first responders, and all that. I'm here with John Feal of the Feel Good Foundation, Dr. Melius of the program. They're going to describe a little bit about why we're here today, what we hope to accomplish. John was down at 9/11 after the attacks. Demo expert, got hurt. What happened? A girder fell on your foot?
Yes, sir.
Had half the foot amputated. Began a lobbying effort over a 10-year period to get first responders covered, and is here now. Tell a little bit about the program and what it does for people.
Well, John, first let me say thank you for taking your time out today on a Sunday. You know, we're here on sacred ground.
Right.
And, you know, every anniversary, most Americans would celebrate an anniversary or a birthday or a significant date. We're here on the anniversary on sacred ground, and there's nothing to celebrate about. 1 year ago, the James C. Droga Health and Compensation Act passed. We have 75 years of free health care.
Right.
But the program will never work at 100% until we get everybody who's entitled, that worked at Ground Zero, that was sick from the aftermath of 9/11. Until we get those people across this country into this program,
right,
we're not doing our job.
That brings up an interesting point. Across this country, it's not just New York City. It's not just this area.
Last year when we were here and we did that video, there were 74,000 people in the program.
Right.
Over the last year, it's jumped to over 76,000 people in the program. So if we can put 2,000 people in the program over the last year since we did a video, there's more out there.
Right.
And we want to reach out to them. And anybody who's watching this needs to know that somebody knows somebody who either died that day or went down there and helped out. Somebody from every state came to New York during the cleanup and the recovery. So there are people there.
Right.
And this program will help them. It's helped me. I wouldn't be here today without that program. I wouldn't be a pain in your ass if
yes,
the
you
program
would.
didn't help me.
You would. Program or not, I think you would still be a pain in my ass. What did they do? So what does the program do for you?
Well, you know, initially you fill out paperwork like
right,
every other government agency, and
right,
but you go through a very intense 2 to 3 hour physical, head to toe,
right,
breathing test, urine, blood work, chest X-ray, a psych test, and any illness that's covered under the James C. Droga Health and Compensation Act will get certified.
Right.
And you'll be treated, and you'll get prescriptions, and if you need surgeries.
Right.
The amount of work that this program offers,
right,
for your heroic services on that day or the days and weeks that followed, this is what we worked so hard for. This is
right,
why we're here today.
Dr. Melius, you know, talk about in terms of, you know, you said you go down there, you take a physical. Do you have to be sick to get into the program?
No. If you're a responder, you're automatically eligible for monitoring for your health, like what John just described to you in terms of the full physical, and they'll monitor you on an annual basis for the rest of your life, and detect any illnesses that might occur, provide the treatment, as John said, for World Trade Center related illness, lung disease, post-traumatic stress, cancer, whatever may occur. If you lived in the area, what we call a survivor and so forth, you're eligible for initial screening for diseases that are on the list. You're not eligible for the monitoring, but if you have one of those diseases, then you get lifetime monitoring for that disease and for your overall condition. So that's, again, you know, good medical care, excellent institutions that provide that care, and you know, given the expense of medical care, what's happening in our country with health insurance, or
right,
what may happen, it's a really important benefit for people.
So what do you think? How many people do you think are not either aware of the program? What do you think are the drawbacks to having full enrollment and all the people that could be eligible for the program, that could benefit the program, get a hold of the program, get enrolled in the program? What are the drawbacks?
Yeah. Well, first of all, the numbers are John already mentioned the 75,000
right,
people that are in the program. But we estimate there are probably at least 30 to 40,000 people out there that are eligible for the program.
First responders.
First responders and survivors that should be in the program and are not. And so we're not talking about just 1,000 or 2,000 a year. We
Right.
want to get more in, and it's important to do it now.
Do you think they don't know about it? Do you think it's a paperwork issue? Do you think it's a stoicism issue, like, hey, we're tough people, it's fine, I'll be fine?
Well, over the last 2 years, we've traveled the United States. Me and
Right.
other 9/11 responders doing seminars and presentations on the program, and so many didn't know about it.
Right.
But here in the New York, New Jersey, Connecticut area, many of them are afraid or reluctant to go into the program because, well, they got 2 more years left on their till they retire and they want their pension. Is the program confidential? And it is.
Right.
It is. You go into that program, there's a thing called HIPAA laws.
Right.
And you're protected by that, and your job would never know. But across the country, we're just not getting that information out there. We're not disseminating it.
Right.
And hopefully today, we create that spider web across this country, because every congressional district was represented at Ground Zero except for 2. One in Alaska and one in California.
Right.
Somebody from every congressional district except
Right.
for 2 went to New York during the cleanup and the recovery. Many of them went home. They don't know that we're here today
Right.
at the 9/11 memorial doing this for them.
Because they're not on Facebook or they're not on the, right.
Yeah.
But that to me is an interesting point though about, so let's say you're a first responder, you put in 18 years, you might be getting a pension. Is the fear that if you go into this program, you'll lose that? Is that a real thing?
Or that you won't make the 20 years that
Or that you won't make the 20 years because they'll find something that's
Right.
wrong with you?
Right. Or if you have they may not want, they're worried about their workers' compensation premiums
Okay.
or something. So they'll.
So how does this impact that, or does it not impact
Well,
that?
the confidentiality is the main thing.
That's the key.
You're not required to tell your employer about this condition. Some employers are really good about it.
Right.
Fire departments had a wonderful program for their people that worked at 9/11.
So there's no downside to this. It's
There's-
not like you're
no.
going to lose something you already have.
Well, like Dr. Mealy said, the FDNY has set the bar high
Yeah.
for
Right.
others to emulate, and they've created a network and a system that
Right.
truly takes care of their members.
Right.
And not to say that others don't, but Dr. Prasant and Dr. Kelly and of course Dr. Mealy and others, 15 years later, science has finally caught up to what we were saying years ago when we
Right.
said we were sick, and they said no, we weren't. The onus is no longer did 9/11 make us sick.
Right.
The onus is now on those who don't believe us, because science has caught up to us.
Has the science, what are the advances they made in the causality of it?
They've made actually very great advances in that. They've shown that the lung diseases and obviously the post-traumatic stress and so forth are directly related and have occurred in a very high rate among the responders and among
Right.
survivors, people in the community. Cancer, we've got that covered in the program. We're starting to see from the follow-up, the epidemiological studies,
Right.
that there is a higher rate of cancer among these people. And we're starting to look at other diseases, autoimmune diseases, neurological diseases.
If you're, for future reference, so let's say you say to yourself, like, I'm not sick now, so why would I need to go into monitoring? I'm fine, I'm healthy. Are there things that they think may manifest in future years that are still related to 9/11 and still related to those exposures?
Oh, absolutely. The cancers we know,
Right.
they occur many years after exposure. But by having people in the program and being able to track them, then you
Right.
can detect the neurological diseases, the other diseases that just aren't evident now.
John, not only are they monitoring us,
Yeah.
or treating us, 9/11 is now being used as a model. God forbid there's another catastrophic event.
Right.
Man-made, Mother Nature, terrorist attack. The statistic that they collected on tens of thousands of people in the program can now be utilized to study, God forbid there's another toxic exposure. So,
Right.
all that hard work that we've done over the last decade, and you've heard Kenny Speck say this last week, that
Yeah.
we become guinea pigs. Reluctantly, we're guinea pigs. But at the end of the day, we've earned that title as
Yeah.
guinea pigs because we helped create
Right.
this program.
And that information is going to be useful to save other lives. There's some people watching at a variety of locations. I want to get a couple of their questions. So this is one from Long Island. Why are the Islanders so terrible? Why are they? Okay, no, that's not the question. Here's the question. I apologize for that. I'm a Rangers fan. This somebody says they weren't down there during the attacks, but they came back to work in the area. Would they be eligible for the program at some level?
Absolutely.
You would be eligible.
They would be eligible. Depends on how long you work. There's some
Right.
time limits, but it carries on for months or after that.
If you worked in the vicinity, what's the cutoff?
South of Canal Street.
Anybody south of Canal Street
Yeah.
who worked in the area south of Canal Street
Yeah.
Correct.
could be eligible to be screened, and if something is found, monitored.
Right. And
Okay.
if you worked on ground zero, around ground zero,
Yeah.
then you're eligible for this responder program.
And the Islanders spend too much money on
Yeah, no, I understand.
Tavares,
that.
and,
Tavares
they don't
is
have a lot
the
of
thing. I knew
money
you were
to
going
go
to answer that
around.
question. I knew that was going to be the way it went. Here's, you know what? Let's start bringing in some people that have been directly affected by the program, helped by the program. First, let's bring in Kenny. Kenny Anderson, New York
How you doing?
City police officer on 9/11. Kenny, good to see
How
you
you doing?
again.
Thank you, John.
You've been diagnosed with 9/11 related illnesses.
Yes, I have. They diagnosed me with hyperactive airway disease and severe asthma as directly related to the World Trade Center incident.
Right. Because people don't realize, so when you were down there in the rescue and recovery, people weren't protected.
Yeah, the first several times that I was down there, and the day that I believed that I got sick.
Yeah.
And just as an aside, the guy I was working with that day died from lung issues
Right.
as his exposure. We were provided with nothing for the first 4 hours we were down there, and then a supervisor came by and gave us what is a dust mask, like you would wear in your living room when you were gonna, take a piece of sandpaper to the wall. It provided maybe 15 minutes worth of protection, then it clogged and it was useless. I couldn't use it anymore. So I
Right.
spent probably about 11 and a half hours breathing in stuff that I couldn't see 150 feet down the road. I'm breathing this in for 11 and a half hours.
No, I remember that dust was, and
Yeah.
the smell of it, and it was like a, what do they call those in war, a burn pit.
Yeah,
I mean, it was
basically.
basically a burn
Yes.
pit of chemicals.
Well, the fires burned for 100 days.
Right.
And Kenny's a perfect example of those who got sick and the absorption through the nose, mouth, and skin.
Right.
We ate there. We
Right.
slept there. We worked there.
Right.
We cried there.
Right.
We went to the bathroom there.
Right.
So we expose ourselves in every possible way that a human can expose themselves.
So you got involved in the program.
Yes.
What have they been able to do? So do they get you?
I'll tell you, the program's been phenomenal, not just for me, but for my wife as well. My wife's a retired police officer.
Right.
And I got sick early on. I got sick almost immediately. And I started having what's known as the World Trade Center cough in October of
Oh, wow.
2001.
Okay.
And so I got into the program relatively early, and I took advantage of it. And I want to thank the doctor and the other doctors and nurses. They've been phenomenal. They've been able to provide me not just with an outlet to go get my treatment, but they've been able to provide me a godsend with the medication. People don't realize, they say, oh, cops, they got this great insurance. But when you retire, you wind up having to pay for 30% of your medication.
Right.
And when you're on 15 medications and one medication's $1,000, that one medication's $300.
Right.
You have 4 or 5 of those. Guess what? You don't have
Right.
a pension anymore.
And you got kids, and you got a whole
and
thing.
you got kids and expenses and inflation, just like everybody else sitting at the table. And just as an aside, I think it's really important that not just cops and firemen, they tend not to look out for themselves. They
Right.
tend to want to look out for other people. And I got to stress this, and one thing I want to make sure that I get out is cops and firemen watching this today and their families need to realize when you go to this program and you get help for yourself, you're not just helping yourself. The information that they get from you and your conditions and where you were and the treatment that they have to give you is all compiled and it's put in and it's evaluated, and it helps other people down the road when they get cancer or they get lung problems. And it's also extremely important that you go now and you get a baseline of
Right.
what your condition is. I made my wife go. My wife spent the last 10 years basically taking care of me, worrying about me, where
Right.
I needed to go, the medications I needed to get. And I made her go down there, and guess what? We found out she's lost 60% of her lung capacity.
Right.
She's had a bunch of other conditions we didn't realize. She said, oh, I'm getting a little heavy, I'm getting older, I'm 41, I can't breathe like I used to. Guess
Right.
what? She can't breathe like she used to because she spent 3.5 weeks down in the dump at Staten Island sifting through this stuff, and now she has lung issues as well.
Right. Which brings up, so 911wereyouThere.com
Yes.
is the place to go where you can get that information.
Absolutely.
You can sign up. Talk about if you. Well, you know what? Well, that's perfect. That's great, and we really appreciate it, Kenny.
No problem.
Let's bring in
a
Michael
lot, guys.
and see what he's doing. Thank you.
Thank you.
And we'll see you again, Michael. Do we have a chair? Oh, No, Michael, you got to stand. I'm
That's
sorry.
fine. I don't mind.
It is going to be what it is.
Thank you for having me.
Room, yeah.
And listen, thank you for the crack on the Islanders. I'm a diehard Ranger fan, so I
Thank
like
you. It's
that.
got to be done. This is Lieutenant Michael O'Connell. You were down at the World Trade Center, 25-year-old kid, right?
Yes.
You take in all these toxins. You tell me about this sarcoidosis.
Yes. Like John said, 25 years old, I was a New York City firefighter. 6 years later, I was diagnosed with a rare autoimmune disease called sarcoid. Instantaneously put me in the hospital.
Right.
Couldn't move, didn't know what it was. Doctors thought it was lymphoma. And they brought me right in. They biopsied what they needed to do, and the doctors helped me out. The program itself was tremendous. I was one of the youngest firefighters or first responders to get sick, and being a member of this program helped tremendously.
And these aren't the kind of things that people normally, like you're seeing a higher rate of this from.
Oh, absolutely. In fact, there was the higher rate in the fire department peaked in the first few years, immediately after 9/11.
Right.
So it was a reaction to all of what they breathed in, and we don't understand exactly why it occurred, but we're seeing that, and we're seeing it continue to see more and more cases of sarcoidosis.
Right.
And with a lot of other manifestations outside the lungs from that disease.
But so you're like, I mean, you're a kid at that point.
Yeah.
Like, get involved in this program. Are you thinking to yourself like, this can't even be real, and now I got to jump through these administrative hoops? Like, how do people navigate just the paperwork and all that?
They actually make it quite simple. I mean, just going online. They walk you through the process pretty easily.
Right.
And it's just a matter of getting on the computer and punching
Right.
punching in the address. They'll walk you through it, and it helps tremendously. I mean, for us, first responders, not even first responders, anybody that was down there, we feel it's not, if you're going to get sick, it's just when. And
Right.
that's a tremendous burden on all of us. And being married now, I mean, I was a kid 25 years old on that day, 40 today. I'm married with 3 kids.
Yeah.
That's the biggest aspect, is the medical monitoring that this program offers us.
Right.
That, they stay on top of us. Early detection is huge.
Michael doesn't want to brag. His son, hockey player, winning goal today. Just saying. This is we were talking the Islanders earlier,
That's
but I assume you're thinking he's going Rangers when he
Yeah,
goes.
we're proud of Aiden. Yeah, he's going in the draft pretty early.
Well, when you said the phone lines were open, so who are they calling?
Yes, so if they go to website 911wereyouThere.com.
911wereyouThere.com.
There's 2 different programs that they can go to, and I know
Okay.
Dr. Emilius and John, you can talk about it as well.
Yeah.
2 phone numbers.
Okay.
The website will tell you which one to call, but is there one that people should usually start with?
So there's 2 websites. For those of you
Yeah.
who can't hear, I don't know if
There's
you're
one
mic'd or
website.
not. There's one website, but there's 2 numbers to call. Do you know what those 2 numbers are and which one to call first?
One is for the health program.
One's for the health program.
And that's probably the one to go to first.
Okay.
If you're not enrolled in the program yet, the support. The other is for the Victims Compensation Fund.
Okay.
And that is the compensation part of the program that after you've diagnosed or if you have
Right.
have a World Trade
And that's
Center
important too.
related
So
illness.
here's a guy, he's got an earning potential. He's 25 years old. He's going to work for 50 years. Now
For
he's
those who
cutting down.
aren't in the
Right.
program, the James Sedroga Health and Compensation Act is a
Yeah.
2-part bill.
Right.
We've been speaking about the healthcare. You've been hearing the stories of them. Then there's the compensation part. So NIOSH administrates the healthcare part.
Okay.
The DOJ administrates the VCF. If you are certified with a 9/11 related illness, you have 2 years to file a claim through the
Okay.
VCF,
Okay.
as I'm sure Michael has done already.
So you go to the health program first, and then once you're enrolled in that, then you can start going through the VCF. Once it's been
Certified.
certified,
Yeah.
Right.
and it's no fraud, waste, and abuse. Like, that's one of the things about this program that blows my mind. Let me tell them the number. It's 888-982-4748. That's the line to call first. That's the health line. Okay, that's the health line.
You know, John, I'm here to paint you a landscape. Everybody that I've introduced you to in the 9/11 community
Yes.
since 2010 is in the program.
Right.
You have not met a 9/11 responder who's not in the program.
Well, so here, but this brings up a point. So when we were down in D.C. on, 2 days ago, we're all going, Ray is there, Kenny's there, we're all walking up. A guy comes out of his car, wants to thank these guys for their service. He starts talking, I'm a vet, I was in Iraq, I was in Afghanistan, was down in 9/11, helping out some of the cleanup, but now I don't really work so much, I'm disabled. Feels like, what do you mean you're disabled? What are you talking about? He goes, have you heard about the program? Sign this guy up on the spot. is down in D.C. And maybe it's that they just don't know about it.
Yeah, no, they don't. And
Right.
John's our best ambassador here around the country.
All right, here's another one from the viewing parties. This is from Manhattan. I think my health problem is from 9/11, but do I have to prove it? How do I prove it? What do I do?
You go in and get checked.
You go in and get checked.
Yes.
What's the worst that can happen? You go in and get checked for free.
Right.
You
And the doctors, you've always talked about, like, the doctors are great.
The staff is all incredible. Every which place I go,
Right.
the nursing staff, the doctors, you first class,
That's
across
awesome.
the board.
All right, Michael, thank you.
Thank you.
Let's bring in, I want to talk, because this actually is more apropos to this question. Hello, Maggie. This is Maggie Garcia.
John, how are you?
Maggie, you were working down in Lower Manhattan,
Yes, correct.
paralegal.
Yes,
So where were you down there?
I was at 90 Broad Street at the time.
90 Broad, okay.
Yes,
So you go away, you come back to work, you're still in this area.
Right.
It's still a toxic soup. You end up getting some health problems.
yes.
So that's exactly what we're talking about here. How did you find out you were eligible? Did you have to go through screening? Was it?
I had to go through screening. I can't remember which friend of mine had advised me to call
Right.
Bellevue Hospital for the World Trade Center program because I just kept getting sick, coughing, and she said, well, you should try it. So I called them up, and the lady who I spoke to said, you should come in now, because I was just coughing. She couldn't understand me.
Right.
I was in constant pain, under scrutiny at the new job that I was. Everybody's looking at me like I have the plague or something, and
Right.
I'm like, oh my God, I'm dying. That's exactly how I felt. I'm like,
Right.
I'm dying. So when I would see the doctors, other doctors outside of the program, they would try their best. They would give me asthma medication, go through the protocol, but nothing was happening. Nothing was helping. And they were at a loss. They didn't know how to help me.
Right.
And so thank God that that September 2006, actually,
So
much
it's 5
later.
years later.
Yes, much later. I called the program and they made an appointment with me immediately, and thank God for them, John. They literally saved my life, literally, and still saving my life today. I
That's
mean,
great.
if you were to see me back then to seeing me now, the fact that I could even speak without coughing up a lung, the fact that I don't go to the emergency room as often as I used to, the fact that I have a better control of my health now, that it's just simply more manageable. The quality of life now is just so much better because my health was deteriorating
Right.
before this program.
You know,
so I'm very
Maggie
grateful.
brings up an interesting point too that I think for everybody who's watching, and again, the people that are probably watching this are probably aware of the program, they're probably enrolled in the program. It's really hopefully incumbent upon them to tell friends and family, to use this group as a way of finding other people. But the thing that I think is so interesting about this is they're seeing diseases other doctors have not seen. It's like when you go to Walter Reed, if you're a veteran, they're seeing injuries that a normal orthopedic surgeon, that a normal doctor in even a city hospital is not going to have a familiarity with. But the doctors who've been treating the victims of 9/11 have seen these illnesses, understand them in a way that maybe another doctor might not.
Yeah.
Yeah, she brought up a good point, though. She said 2006.
Right.
Everybody's immune system's different. You see Ray Pfeiffer.
Right.
He was diagnosed with cancer in 2009.
Right.
What can he expect in 2006? Kenny Anderson, who was here before, 2002.
Right.
So you're seeing different illnesses with a wide broad of symptoms.
Right.
But everybody's different. So we're seeing people in 2016 with cancers or pulmonary fibrosis or some sort of other breathing issue. So everybody's different. So if you were exposed south of Canal Street to these toxins, you'd be a fool not to
Right.
at least get checked. Get that yearly physical, because once you're in the program,
Right.
say you don't go back in you go back in year 3, but you're going to be in the system. And God forbid something happens.
Maggie, how'd you find out about it? Was it, you said a friend of yours told you about it?
A friend of mine I don't recall where she was working at, but she
Right.
was aware of
She was aware of the program.
Of the program, and she
Right.
said, "You should definitely call because
Right.
you used to work there. The most they could do is screen you and test you, and then you could take it from there." And I'm glad I did. I called.
Dr. Mills, what's the harder audience to wrangle to get a hold of? Is it the first responder community? Is it the survivor community? Is it, where's the outreach have its most difficult time finding people to be in the program?
Yeah, I think while both are difficult, I think the survivor, the community population is the one that's the hardest.
Right.
Do that, because I don't think they think of their exposures as being severe enough to have caused illness.
Right.
And what we found out is that many of them did have very high exposures. Not only the dust cloud, but their homes were contaminated. They weren't cleaned up.
Oh, it was covered. I mean, so we were not south of Canal. We were a little bit north of that. But even where we were, the smell, the dust, everything else was all over everything.
You have
And I
other
worked there
great
5 years
organizations doing really good work in the survivor community.
Right.
Voices of September 11th, the 9/11 Environmental.
Yes.
They're out there. They're out there working and reaching. Even the Feel Good Foundation, we advocate for anybody who's affected by 9/11.
Right.
But it is a group of people that need to be reached more than the 9/11 responder community.
Right.
Because let's get it straight. When we say first responder, we're talking about cops and firefighters.
Right.
EMS.
EMS. Yeah.
So when we talk about 9/11 responders, we're talking about that second wave. The construction workers, the laborers, the unions.
People down there feeding them. There's people. I remember they had lines of food.
Sure.
With they had volunteers helping to serve, doing all. People bringing waters. It wasn't just.
And there was a lady
cops
from
and
there was a lady from Minnesota who did that,
Yeah.
and now has leukemia.
Yeah.
But she reached out,
Right.
and she's in the program, and she's
Right.
getting treated.
Right.
So there's that third wave of those people that came. This was a 10-month ordeal.
Yeah. Well, I really appreciate it. Is there any other information that you want to get out to people that might be viewing it, or any other things that they need to know as far as outreach?
Visit the website.
Reiterate the website.
Make that call.
Yep.
Yep, and our hashtag is were you there?
So the hashtag is where you're there. What does a hashtag do? What is it? Is that a thing they got to use?
You know what? It'll start that conversation.
It just starts
That's
the
what we're
conversation.
thinking, 'cause
Okay.
It's an organic conversation, and
I see.
we're hoping to see more.
Oh, to
of
connect
this type
people.
Exactly.
All right.
I thought it was tic-tac-toe.
Exactly.
Right, exactly. 911wereyouThere.com. Hashtag were you there. Do you want to hold up that phone number just one more time, or is that on the screen?
Yep, we can pull it up,
Okay.
and then I will pull it up.
All right.
For you.
And maybe we'll get everybody just back in real quick. If there's anything else anybody wants to say. 888-982-4748. I just want to thank you guys for being here and for
Thank
getting
you
the
for
message
having
out. Maggie, Dr. Cornelius, John Steele, Michael, Kenny. We really appreciate it. And like I say, reach out, friends and family. If you know anybody who may be eligible for this, may be suffering with this, it's a great program. Thank you guys very much for being here. And hopefully we'll get that full enrollment that you guys are seeking, and we won't have to.
Why do you always hit me?
You're very hittable. You're a hittable person. I only hit people my size. Yeah, and there aren't too many of them rolling around. So, and thank you very much for obviously for putting all this together.
Thank you guys.
All right. Thank you.
Thank you, John.
All right.